Starting now.
Hi, I'm going to be talking about CalFresh food benefits. This because it's an inadequate but important help for a whole lot of people to get groceries. With Corona, so many people have lost income, so any semblance of a social safety net is more important than it ever has been before. It's the biggest anti-hunger program in California, and I find there's a lot of misimpressions about it. It's federally funded. Allocations get passed through the Farm Bill. I'm going to give a short overview and also mention a couple of COVID-specific updates. CalFresh has not been called food stamps since 2008 when the federal government changed it to the Supplemental Nutrition Assistance Program, also known as SNAP. Back when it was food stamps, there were physical pieces of paper. Those were the actual stamps, but they went ahead and changed it to supplemental. Part of that is because it's not enough to get all the food. It's not really designed to, but it is designed to let people get more food, more nutritious food for a better life. The feds also allowed states to go and pick their own specific name, so it's CalFresh Food here in California. You aren't taking food benefits away from anyone else who needs them. Anyone who qualifies and applies gets the full amount they're entitled to, and it's not a loan. So as long as people were really eligible for it, they don't have to pay it back. It doesn't have to be reported to the IRS. It's not income. It's just a nutrition supplement. There are, of course, other government programs. Food banks and food pantries rely on both private donations, but also some different government programs that give them food. And a lot of people have heard of the free and reduced price school meal program. That's going to come up later. But CalFresh Benefits is different from those because participating households get their monthly benefits, which they can access through an EBT card, and they can use that like a debit card to buy whatever groceries that they know for themselves and their families that they need. So they get to choose that normally when you can go to the store and the stores have stuff. Then most grocery stores and a lot of convenience stores and supermarkets accept them, and so do farmers markets. So again, that's different than sort of commodities boxes and WIC that's only specific foods. Farmers markets weren't really thought of when they changed it to the electronic system because most farmers markets rely on cash, but a lot of them have mobile EBT machines, so people can use their benefits there and even get extra incentive coupons for extra fruits and vegetables. A lot of people think that you have to either just have lost your job or be homeless, or it's only for people, only for families with young kids or unemployed, but really it's mostly based on income. So people can be from any of these categories and start CalFresh benefits. There are some people who didn't used to be allowed to get them, and there are other groups of people that have specific eligibility rules. Even if someone might not be able to qualify because they don't have an eligible citizenship or immigration status, there might be other people in their household that would qualify. So no one should be discouraged from applying or at least calling and asking. Usually it's just for grocery items, but some people can qualify to get hot meals if they're disabled or homeless or over 60, or and that's because maybe there's issues in preparing food. I said it was, but there were income limits, and that's based on household. The household is who people eat with and they live with, or people assume to be eating and living with them, like their spouse or their children under 22. But people over 60 or who have a federally established disability don't actually have a gross income limit, but there's still a net income limit that they need to make. And they can use regular medical expenses for an income deduction to help qualify for that net income limit. No autoplay. It's an important program for lots of people, and you should help folks apply if you know anyone. Even during physical distancing, people are still able to apply. The application at getcalfresh.org is only about 10 to 15 minutes, and then they call you up for a pretty short interview, and you can apply for someone else. They can help designate you as an authorized representative, and if you go through a tablet or a phone, you can upload documents they need. As of April 28th, people can use their EBT cards to make purchases online. But only at Amazon and Walmart. Second COVID update, children eligible for free and reduced price lunches are eligible for a new benefit, pandemic EBT or PEBT, but people who already have CalFresh don't need to apply. But that is something new with COVID just this month, and the application for people who don't already get CalFresh isn't available yet, but should be soon. Final COVID update, they were about to implement work requirements for able-bodied adults without dependents, but that was delayed. The federal government had said a waiver was going to go away and people were going to have to start fulfilling this, but that is delayed for the time being. CalFresh is a political football. That was part of why they were getting rid of the waiver. There are a lot of chances to help defend it. People rely on it to eat, and if you were going to get federal financial aid, and either you know billionaires look down on tax benefits, and this is no different. It's anyone who qualifies and is interested should apply. Thanks for your time. 15 seconds, so fast.
Thank you. And are there some questions? Renata, I'll have you unmute yourself.
Thank you.
I just did. Actually, I just did it.
I did it too.
Okay.
So bright.
Too bright. Thank you, first of all, for being involved in that and for telling us about it. I am curious about that video. Is there any way to show us that video, David?
Let me see if I can do it. Let's go back to it, and I'll see if I can go to that screen and take away the 15-second thing. One moment, please.
It's a 15-second video.
In the meantime, if anyone else wants to ask a question, maybe.
Yeah, I wanted to ask a question, so I'll steal her time. So what I was going to ask is related to the stigma of it, which feels like a thing to me, and I wonder what would it cost if everybody got the stipend, and so like just part of what you were going to spend on food on a monthly basis came out of that instead of out of your paycheck, and it was paid for by taxes or whatever. Like what's the scale of how much this might cost if it was kind of more of a universal basic income style thing?
I don't know, but the not at all left economist Milton Friedman supported universal basic income just because this patchwork system that we have is so expensive. Like CalFresh costs less to implement than comparable programs that don't do quite as much good, but part of that is because people can spend it on whatever they want. Like, it'd be a lot more expensive to make that more complicated, even though that's something people want to do a lot. But I think it would end up being cheaper, because it doesn't even, it costs a lot to administer. It still doesn't get you all your food. You need other sources, and there are some other sources, but that ends up being a lot of stress and a lot of work to patch that together. So I can imagine that being cheaper.
I'm going to try to do the screen, and we'll see what happens. I'm just going to share it and then play it. One moment, please. No sound, though. Oh, okay.
No sound. If I play it on YouTube and share my screen, will people get sound?
I don't know.
Give it a shot.
So there's a specific option when you share your screen, you have to enable to share audio as well. It's at the bottom when you share.
Okay, let me try it again.
I can also send the link if anyone's interested to watch it later.
And these are for mom.
How do we afford all this?
We didn't. I signed mom up for CalFresh food benefits. It was easy. And now I can make sure she gets even more healthy food.
Apply today. Go to calfreshfood.org, call 1-877-847-FOOD, or visit your local county social service office.
15 seconds. Picked a short video.
All right, are there other questions? Garrett.
So I know this wasn't the topic of your discussion, but it sounds like even though you love this program, you'd be happy if it got replaced by universal basic income.
Yeah, I would. In my so anytime change, you end up helping some people and hurting others. Like a recent change in CalFresh was actually prior to last June. People getting SSI couldn't get CalFresh benefits, and now they can, and that's great, and that helps a whole lot of people. But there were some it doesn't, because suddenly they're counting that income in that household, and so maybe they're getting less benefits or even don't qualify at all anymore. And there was a new program to help those particular households, but that's an example of that. But when I've heard proposals for universal basic income where people have a little bit of a choice if they like the program they're on, if that provides something that makes some sense to me, at least for a transitional period, like where some people might pick that even if it ends up being less benefits in some way, just because the reporting requirements are a lot less, and the reporting requirements for CalFresh are higher than or can be burdensome to people. They're higher than like for Medi-Cal, which is what Medicaid is called in California.
So what do you have to do to get it? Do you have to like submit your pay stubs every time you get paid or something like that?
Not every time you get paid. You need, it's based on income, so you need proof of income. And most people are on a 6-month reporting cycle. So you need to submit proof, or sometimes you don't need to submit proof if you have proof of your yearly income or something every 6 months, but you need a very short form you need to fill out that's 13 questions that you can fill out online or by paper, or at least in Sacramento County, and some increasingly more so by phone. But there are some people, again, from the elderly or with the federally established disability that don't have to do that as often, that they might not have to report anything except every 36 months. And if you, it's complicated, but if you make under an amount, you don't have to report every time your income changes. But even if it's not that 6-month report, you do have to report if you go over the certain amount. But if you started over that certain amount, you don't need to report anything until they ask you stuff. And that way, that's actually more flexible than technically Medicaid, because that you're supposed to, for Medi-Cal, you're supposed to report every time your income changes. So even though people don't, but in that way, CalFresh is actually more flexible.
Cool, thanks.
Yeah.
All right, Jane had a question. Is your audio working yet? No. Let me unmute you on my end.
All right. I'll
Oh, there it works.
Jane, we can hear you.
We can hear you, Jane.
we can?
Yeah.
Yes.
Woo!
It's a miracle.
Never mind. Okay. So I am a teacher, and the schools that I teach at, it's about half of our students receive free and reduced lunch. If I wanted to send out like an email blast to my students and say, hey, you might not know, but this has been expanded for families in the wake of this COVID issue, like what would be sort of the main, like the link that I would send them to that would be the easiest for them to just get started there?
Usually programs like this take a lot longer than they have to set up. So there's not an online application yet, but I'll send you the link where I got the information and where there should be one available. However, I don't know the best way to do that, but to email someone, it sends out blasts, or?
Yeah, could we are doing things a little differently, obviously, now that we're online, but usually we send out at least like a Facebook thing afterwards with links, but we could also do the email thing that we used to. Trip, David, and Jamie can talk about that. But
yeah,
yes,
just send it to any of us and we'll get it out.
Yeah.
Very good. Thank you. Ocean, are you still there? He had his hand up. Now he's invisible. Oh, there he is.
I'm back.
All right.
I had to turn off the kitchen timer. Yeah, so aside from just spreading the word, getting information out there, is there any call to action? Is there anything like I don't need to apply? I'm fortunate to not be in that place. I would love to support obviously it's not like a thing you donate to or whatever, it's a government program, but are there any legal challenges it's encountering at the moment? Is there anything that you would tell the average person to do to help support it aside from just promoting it?
I look for it's a federal program, although California also passes both laws about it, both statutes and also the Department of Social Services makes specific regulations. And because we live in California, the thing that makes me the angriest usually tends to be from the federal administration that I look out for the public comment periods. For example, the able-bodied adult without dependents was a decision to get rid of that waiver, and I'm glad that that's been postponed. But I no longer work for the Department of Social Services, so I'm just a person, but I have such weird wonky knowledge. So that's part of why I was excited to share something after several years in a funny little program. But both the California Association of Food Banks and the California Food Policy Association do reasonable advocacy and let you know when there are public comment periods, when there are challenges to it. It's not always 100% accurate, I would say, but I think they're right when things are upsetting. Something interesting about the free and reduced price lunch change is that something advocates have been asking for and trying to get passed for a long time, and the position has been that's completely impossible, and suddenly now we have it from the federal government. So that's interesting. You know, there are definitely advocates calling for that, but they keep passing things. Specifically, this gets usually passed through the Farm Bill. So sometimes we hear people who follow funny food things here when there's a Farm Bill, and maybe normal people just follow news sources. That is when it's being allocated and asking to keep funding it and to not make it harder to get, and to not get rid of it. In particular, I was looking for an update, but so those gross income limits that I gave, that is 200% of the federal poverty level. And we are able to do that in California basically through a loophole because that's not the federal limit. It's a really funny loophole called broad-based categorical eligibility that the Trump administration specifically wants to get rid of and calls it a loophole. And it kind of is, but it's one to help get people food who need it. So I'd like to keep that. And that exception that we use is also why we don't count resources. Why it's really just, for most people on it, it's just for income. It doesn't matter how much you own. And so if that went away, they'd be counting how much you own. It would be a lower income limit, and it would just be more cumbersome. It'd be harder to apply because you'd need proof of any car you own, what's in your bank account. That'd be longer processing times for most people, and more taxes for stressed eligibility workers to process all those funny documents. So I don't think broad-based categorical eligibility makes great headlines, but that is an attack that's been happening at the federal level.
Thank you. I think Yafa had a question.
Shaina, having the benefit of knowing you, I know you're working more in food bank type stuff now. Is there something more in that realm that people could be helpful in?
Maybe. Food banks are essential services, and they are down volunteers because a lot of their volunteers were seniors, but they're also really worried about keeping volunteers safe. So if there is one, if you're not immune compromised and you're not, from a more vulnerable group and you're sitting at home and bored with nothing to do, definitely reach out, and see if there's a way you can help, or there might be pickups you can do, safely. If you're lucky enough to not have lost income, their sources have sort of gone away. They were real fast as some, restaurants were like, we're not gonna be able to serve any food, and they donated it, but now restaurants, were closed and they're not donating anything, and people are buying out the grocery stores. So the normal non-governmental sources for food banks are kind of dried up and they're scrambling. So yeah, I would definitely support your local food bank and ask what they need, whether that's donations of money, of food, of your time. Thanks.
Jamie.
Hi. So next to our house, or pretty close to our house, there's a little grocery store that seems to be almost completely focused on the WIC, women, infant, children. So my question is, I think I've seen some things on the internet that have said, if you see something that's labeled as being specifically for one of these kinds of programs, whether that's women, infant, children, or maybe some of the other ones, you should not buy it off of the shelf if you're at a grocery store. In order to, like, if you're not on the program yourself, you should leave it there so that other people who could get it at that maybe a discounted rate or something like that would have access to it. Is that a real internet thing or a fake internet thing? And is there any other way that we can, what should we be looking for as, you know, general consumers in order to not put other people at a further disadvantage, I guess is my question.
I'm not totally sure if it's real. So, WIC, people, it's similar where people use benefits to buy food, you know, at the store, but it's only for specific items. Some stores only have WIC items. And I have seen a rebuttal to that saying, if they're out of that food, they're supposed to let people get a different item, but I'm not sure if that's true. I've never actually worked in the WIC program and don't know as much about it as I'd like to. And also, even if it's true, I'm not totally sure that that would happen at the store level, because at the store you'd want to keep your permission to be able to be accepting these benefits and getting the income that your store gets. So they'd be, if they weren't sure, they might be more conservative than less, and they'd want to follow the rules, because that sounds confusing to me. So so I'm not sure, but there should be a label, like often right by the price, it'll say WIC, you know, and they're healthier-ish by the USDA standards. So it's, I mean, it's milk, dairy, cheese, vegetables, you know, fruit. So it's food, maybe not soda. So you can buy as much soda as you like without worrying about affecting WIC. But I'm not sure about the other items, sorry.
Healthier-ish sounds like every diet I've ever been on. So yeah, I get it. Yeah.
Yeah. USDA My Plate, very specific healthy definition.
All right, one last question. Brad. You're muted still, Brad. You're still muted, Brad.
I am now unmuted, right?
Yes, you are.
Okay, sorry it took so long. There certainly are hoops people have to jump through in order to get these benefits. Do you have any, just as a guess, let's say that we proactively identify these individuals, approach them saying, hey, you need this, you can have it. How many people get lost in jumping through the hoops that do deserve benefits but don't get them? Just as a rough guess.
California does worse than other states, I know, in terms of the estimated number of eligible people who actually enroll in it. I don't have any of those numbers, but most people get lost in the hoops. Most people who could get, you know, use the up to $194 per person per month don't get it. So if we could make it more automatic, the IRS pretty much already has people's income information, and
that's what I thought. Yeah,
we get it. We could help folks, but some people don't want to be in the program. It's voluntary, and it is more serious about confidentiality than a lot of other programs, because, you know, it's no one else's business if you're on it, because there's concern about the stigma.
Okay, thank you.
Thank you, Shaina. Give her a big hand.
Thanks, everybody.